At Houston Methodist Hospital, one of the major hospitals in Houston, Dr. Beau Briese is an emergency room physician there. So, Dr. Briese, welcome back to my show. You're becoming a media sensation.
I guess so. The picture of me in a hat in the New York Times, like I said it, but it's good to be back on the air with you.
Thank you. Well, you have a better chance of doing this than I do of doing your work. Let's put it that way. There is no danger of my being an emergency room physician. So,
well,
let me ask you, because it's now a bombardment in the news that Houston will be the new New York City, and the hospitals are now they're moving ICU patients into extra rooms and so on. What is actually happening?
Well, what's actually happening is that overall, considering that we had a peak that happened probably peaked about 2 weeks ago in terms of initial onset of cases, we're doing really well. We have more capacity than we need to deal with the issue at hand. We did have the disease lasts about 3 weeks. So about 2 weeks ago in the ERs, we had our peak volume, and then it's been steadily declining. For example, this week was about 25% lower in our system than it was 2 weeks ago. And so you see the deaths peak, a couple of weeks later, the folks that unfortunately pass away from this illness. So we did have our biggest number of deaths in Texas this week. 112 people passed away on one day this week, which means that compared to New York, since the comparison seems to be to New York that we're seeing in the media over and over and over again, we hit 11% of their worst day.
Not quite
11%.
Not quite the new New York. That's on your worst day.
No. Yeah, that's our worst day. And just to put that in perspective, remember Texas has 50% more people. We've got 50% more people in Texas,
right,
than New York. So in order for us to be in a similar level for the rate of death from coronavirus in Texas compared to New York, for the rate of death, we would have to have more than double our worst day every single day for the rest of the year, assuming no one dies in New York of coronavirus for the rest of the year. It's a completely false narrative. We're going to work. It's a little less slow than it should be because folks with cancer, diabetes, end-stage renal disease, with electrolyte issues, people with strokes, they're not showing up in our ERs because they're so afraid to, because the media has terrified them. And a very interesting study came out today. I don't know if you saw it. VCU and Yale got together and did some data on excess deaths that's occurred recently. And in March and April, about 30,000 more people died, plus or minus, than should have, not because of coronavirus deaths. And it seems like a lot of that was because folks weren't able to get in to see their doctors, weren't able to get their prescriptions, were too terrified to show up at emergency departments for legitimate emergencies like chest pain that was a sign of heart attack.
So it wasn't from the coronavirus?
Well, there were excess deaths from coronavirus.
No, clearly, but I'm saying, but a serious percentage of it was not from the virus. It was from people not getting treated.
35% of the excess deaths were from people not being treated. And it's the fear and it's the destruction of the economy and all of its effects. My little girl can't go to dance class. Right? She can't go to dance class. The arts are closed. Elton John can't perform. We can't enjoy sports. We can't educate our children. Literally every part of what makes our culture what it is being destroyed. And to the extent that we have history, folks are taking care of that with statues. So it is as we typically see. I'll be direct here. I think that what we're seeing is an attempt to change the narrative because the left did so poorly in dealing with coronavirus compared to the right, that they have to make this be what the story is. And, when I was talking with the New York...
hold on there. This is really important. Please stay on. Dr. Beau Briese, Houston Methodist Hospital.